Hello, my name is Edna Adan Ismail, and I am so honored and so happy to be joining you virtually from Somaliland, a country in the Horn of Africa. Next slide, please. And I have no conflict of interest. From Somaliland, a country in the Horn of Africa, which has a population of about 5 million. It's a country that is bigger than 18 countries in Africa. It is as big as England and Wales combined. So there's a vast area, not very dense population. We have about 850 kilometers of coastline placed between Djibouti, former French Somaliland, and former Italian Somalia, with whom we've had a war. And as you see on the slide, these are the results of war. War destroys, war damages, war prevents progress. And after 9 or 10 years of very aggressive war, where hospitals were destroyed, 95% of the country was leveled to the ground, 250,000 people killed, the country was liberated in 1991. On this slide, you will see the state of the hospitals after we liberated the country. This is a hospital, I mean, the picture there, the only healthy thing there is perhaps the goat. And I don't think I would trust my life with treating anybody of any disease because it's what humans should be doing. Somaliland being the poorest country, the best thing that we could do to address the health problems of the nation is to build hospitals, but also to train health professionals, because it's not the buildings that treat people, it's the knowledge and the skills of the health professionals. In 1997, I retired from a long career with the World Health Organization, came back to my country, Somaliland, and my contribution, the only contribution I could give to my country, is to build a hospital and try to help my people find help with at least reproductive health. So we embarked on a very energetic training of nurses and midwives and doctors and lab technicians and pharmacists. We've started at least 7 different training programs in 4 different sites to train lab technicians, pharmacists, medical doctors, nurses, midwives, and empowered women to take their responsibility in the healthcare and in the running of the country. And this particular slide will show you the head surgeon is a female, the assistant surgeon is a female, the anesthetist is a female, the instrument nurse is a female. In a hospital that has a female supervisor of the operating theaters, in a hospital that was built by a woman, this is the kind of progress that Somaliland was making, which was making us very proud and making us very focused on where we want to get to. Education, academic empowerment of women, that was our goal. And we were achieving far better than many countries were doing. Today, we're talking about a drought that has decimated 60% of the livestock of our people who are nomads, and the economy was based on the export of sheep and goats and camels. And because of the war, the grazing became, the pasture land dried up, the rains failed, we had locust infestations just before the drought, and our animals had no water, had no food, had no fodder, and just perished. So the only way we could keep whatever stock of animals were still alive was to try and do some water trucking and take water to remote areas, dried up areas, dusty areas, areas that had no roads, that had no wells, that had nothing, just a few dying animals and a few very, very, very malnourished and very tired and weak humans. And the best we could do is take some food and take some water. Luckily, the rains came back, but it takes a while for nature to pick up again and for grass to grow and for animals to become healthy again. And when we come to oncology, treating cancer, starts with the prevention, the lifestyle. But if cancer occurs, it's the early diagnosis. It's being able to take specimens, histopathology, and determine what type of a cancer, if it is a cancer. Is it malignant? Is it a benign tumor? And if it's confirmed to be a cancer and a malignant new growth, then what? We need surgery. We need radiation. We need chemotherapy. And we need the know-how and the facilities and the health professionals who are able to do that safely. Because if we kill the patient while wanting to treat them of cancer, and kill them because we don't know how to use chemo and we don't know how to use radiation properly, and we're not able to do the surgery, the safe surgery, and the patients die on the table because of poor anesthesia, then we haven't done what we should be doing. So this is again where training has come in. And in order to make surgery safer, we have embarked on the training of yet one new category of health professionals. That's the nurse anesthetist. And today we have trained close to 40 nurse anesthetists, so we can send them out to different regional and district hospitals so that surgery, at least safe anesthesia, can be administered. We also have to embark on a very aggressive reconstruction and maintenance of our operating theaters. The theater needs to be clean. The theater needs to have electricity. The theater needs to have water. The theater needs to have facility to sterilize and clean whatever equipment or instruments are being used. The staff need to be trained. We need to have the right sutures. We need to have the right kind of nurses, instrument nurses, to help that surgeon. And then, of course, we need post-operative care, and we need a follow-up of that patient. We need blood transfusions. We need a functioning laboratory. We need medication. We need dressings. So all of that goes around treating a patient, whether it's for cancer or for something else. And this is where Somaliland is at today. In every region of Somaliland and every hospital in Somaliland, we're able to train health nurses, at least raise the bar when it comes to nursing, raise the bar when it comes to midwifery, raise the bar when it comes to the care of our babies. So this is the message that I sent you from Somaliland, a country that everything is gone against us. Poor country, high maternal mortality, and then the drought, the war. These are families who have nowhere to go. They don't engage in agriculture because there's no water. They don't know agriculture because they're nomads. And all they knew was to move their herds from one place to another where it had rained and where there was some grazing. This is the story that I'm bringing from Somaliland, and I hope it's a story that tells the message of how serious the situation is in the Horn of Africa when it comes to the ongoing drought. There's a lot of reporting in the media. The UN has carried out a lot of surveys, has sent out lots of appeals and messages, but the appeal that I am adding to whatever appeal is out there by the international community is Somaliland is that country which is one of the poorest and which is forgotten because of its political isolation. Somaliland needs to be on the map of the nations, and at least if it's not there, it should be in the conscience of those who are doing, hopefully, a distribution that is equitable, that is fair, that is not based on politics, but is based on the human need and the need to address the human tragedy that is unfolding in the Horn of Africa, in Somaliland, and in the part of the world which needs health the most. So I thank you all for giving me this chance to join you virtually. I'm sure there are messages in the internet that you can read about Somaliland, but please know that Somaliland is politically isolated. And I hope that weighs heavily on the conscience of the politicians who make decisions about who is recognized and who is not. Thank you all so very much. And thank you for giving me this chance.